So the plan I have for her is to start to treat the base of this wrinkle and then to do a more aggressive treatments just around here and there, and a more superficial treatments on the forehead. So to start to treat the wrinkles, that's fine, thank you. I put the device on the deep mode. In the deep mode, I can deliver a shot of 0.12mm in diameter, so it's 120 microns, and I will use aggressive settings, means 20 millijoule for each of them. The line shape, and 5% density, and that's fine, and I can go. The forehead is okay. Okay, that's fine. I want to, that's okay. So I realize where the wrinkle is, and then I do the first shot. The second, and I'm following the base of each wrinkle. I'm following each deep wrinkles on her mouth. I am not sure that the camera can show you, but here it's absolutely clear that we have very small ablation. The idea of this first step of the treatment is to have a great collagen production exactly where we need. And I mean, at the base of each wrinkle, we need a lot of collagen to have an elevation of the base. So okay, I'm using 20 millijoule for each micro shot and a density of 5%. I do not need to ablate skin. The idea of this first part is to stimulate new collagen production exactly where we need, so at the base of the wrinkle. Okay, so we concluded this part, and then I want to do an aggressive treatment, so I move to a combo mode. Combo mode means that we have one after the other the deep treatments, and immediately after we will have the superficial treatment. So yeah, now in this area around the mouth, upper, lower and upper lip, and on the other side I will use the combo mode. I will use 12.5 millijoule and 5% coverage for the deep. Okay. So, and I will use 80 millijoule for the superficial. Okay, I'm ready. Let's go. Okay, I'm trying to cover all the surface, avoiding to do a lot of overlapping, but this is not so important. The madam is a fantastic model because I'm sure she has just a little pain. We applied the anesthetic cream 1 hour before the treatment, and the patient started to take antiviral drugs yesterday. So little tips for beginners: you can apply the tongue depressor exactly and where there is the line between the mucosa and the skin, and so when you do the treatment there's no risk for the mucosa. So apply the tongue depressor and go ahead. Look, no problems for the line. Okay, so it's a very simple thing to do. I am following the upper lip, the lower lip line, sorry. Okay, now it's easier to do the chin. The delay time between one shot and the other is 0.5 seconds. So look, I go just a little slower, deep, superficial, deep and superficial, deep and superficial. Again, deep and superficial. Okay, I take again my tongue depressor and I will do the upper lip. So exactly at the junction between the red mucosa and the white skin. And this is to protect the mucosa this way. Look, probably here is clear, I do not know with the camera, we have a pinpoint bleeding there, and this is a very important hand point to understand if you are doing a good job or not, because this is a clear sign of where you are working. Having a pinpoint bleeding, we have a very nice idea on where we are treating, okay? Then we can conclude the upper lip. Okay. The other sides of the face don't need to do the combo mode, so I will choose the superficial only because I want to do a superficial treatment. I will use the square shape with a coverage of 40% and the energy of 70 and the time of as quick as possible. Okay, it's 0.3 seconds between one shot and the other, and I will go very fast to cover the cheek. Another tip here is to stretch the skin. I will use a gauze because to avoid any problems. Look, or in this way, I prefer this one, but it's easier here to do that, and so you can follow the jawline, you can appreciate the jawline, and we can go very fast. The tip of my finger are exactly on the orbital bone, so I know that here there's the orbital bone. I have not to pass over. Look here, It's a very fast treatment. Side, Madam, can you turn it? Thank you so much. Look, jawline, okay, here, and I can go to treat here.